Hello, friends and colleagues. Today we are continuing our series about pain and problems that occur in the legs, and today we will talk about the hip. I will periodically change position in the space so that it is more convenient for you to see how I work. The first place from which you must definitely start working is the lateral surface of the thigh. This is called the iliotibial tract. This is a structure that is a tendon from the muscle that strains the fascia lata of the thigh and the gluteus maximus. It is problems with this structure that causes fat to grow in an awkward area. A large amount of fat can accumulate here, and it would be okay if it were not very beautiful, but it is still wildly unhealthy. This is because it can lead to distortion in the pelvis, numbness in that zone in the pelvis, the appearance of veins, and moreover, a person becomes much less stable when trying to prevent a fall to the side. And this area definitely needs to be worked on. We remember that in some cases it will be problematic due to the fact that there are problems in it. In some cases, it is necessary to work with the pelvic region. The next place that we definitely need to pay attention to is the space along the back of the thigh. This is a space between the biceps femoris on the one side and the semimembraninous and semitendinous muscles on the other side. Here in this space, the sciatic nerve is located, and if this space fuses with each other, this happens quite often. This leads to the fact that a person has unpleasant sensations in the legs, such as numbness in the legs and cold feet. It looks extremely unsightly. Here we have a young model, but now we have a fusion between these structures. This means that, for example, leaning forward will be difficult for our model if after a while it doesn't have a sufficient flexibility. The places of attachment along the ischial bones can become inflamed and form a roll of fat along the buttocks here, which can look not too pleasant. You definitely need to work with the inner surface of the thigh. Let me go to the other side. The inner surface of the thigh is the place where the body collects limbs from the lower extremities, and if the limb stagnates here, this has an extremely negative effect on the state of the genitourinary system. This is a decrease in libido. This is the formation of the tumor processes. For example, uterine fibroids very often occur due to the fact that lymph accumulates here, inflammatory processes. This lymph goes to the structures that pass by the genitals. This area here should be free and clean from stagnant limbs. Let's continue. The inner thigh. We must remember that not only is there a huge quality of lymph vessels here, but also there are structures that are responsible for the rotation of the hip, the adductor muscles. A change in the shape of the legs, X-shaped knees, U-shaped knees, disruption of the hip joints, all these are clear signs of the dysfunction of the adductor muscles. We must remember that in order to work out these structures well, we'll need to understand where they're attached, we need to understand the direction of their movement and work, and most importantly, understand how to work in order to provide maximum assistance and support to the structure. It is very important to learn how to relax the hamstring and feel the deep tension that is in this area, because if the hamstring and the whole of the thighs are tense, this will lead to the risk of varicose veins because the blood in the legs will not be able to rise freely. And here my model has tension, and it is very important to teach the body to work with this structure so that this tension ceases to be chronic and the body relaxes and unfolds at the moment of rest. The next area that we need to work with is on the calf area. Remember that the joint area is an area that needs to be worked very carefully. And with the area of the knee joint, we work with maximum delicacy. Although, it is the work with the area of the knee joint that will greatly affect the condition of your knees. If you've had crucial ligament tears, if you've had meniscus problems, then remember that working with the hamstring muscle and with the area under the knee and the lymph nodes is extremely important in order to solve these problems. In general, specialists rarely massage the calf muscles in the lower leg area. It can be very pleasant and is very beneficial for the body when working and giving attention to these often neglected areas. The fact is that a huge amount of tension accumulates in the calves especially in girls who walk in heels and in men who have a lot of stress in their lives. The fact is that the body in the natural environment in the first place, with any emotion or danger, turned on the calf muscles so that we could quickly escape. But in our daily life, we rarely have the opportunity to escape from the boss, and therefore we accumulate a huge amount of tension in the calves. This leads to a feeling of general physical fatigue, and this leads to the fact that blood accumulates in these areas, and this leads to an increased load on the heart. There are studies that show that tight calf muscles can lead to an increased risk of heart attacks. That is, the heart wears out much faster. The last thing I will talk about is what is called a wide ankle. This here is a wide ankle. In most cases, it's not a physique, it is swelling. Here, fluid accumulates on the inner and outer surfaces of the calf muscles, and it accumulates due to the fact that the muscles on the lower leg do not work normally, due to the fact that the lymph nodes do not work normally on the back and on the inner surface of the thigh. And it is work with these structures that will help solve this problem and make your ankles slender and beautiful. And that's it for today. I invite you to watch the previous video and wait for the next videos. And in order to not miss them, be sure to subscribe to our channel, press the notification bell, and leave your comments below, and send this video to your friends in order to encourage us to release similar videos. Well, as always, my name is Stanislav Chernonog, the author and creator of the online school Vector Massage and Somatics, and the community of the same name. Check out our sponsorship channel and support us. Check out those wonderful materials on self-massage and practices that we have as part of a subscription. Goodbye, dear friends, and see you soon.